State is now moving forward on the mental health part of the package of new laws passed in the aftermath of the tragedy at Sandy Hook.
The new gun laws went on the books on January 1st. School security upgrades are already underway, but this just may be the most difficult part of it. Chief Political Correspondent Mark Davis joins us live with more on that. Good evening, Mark.
Hi, Keith and Ann. Good evening, everyone from the Hartford newsroom. The state is about to begin a series of at least a dozen public forums around the state seeking input from the public, from families, on how to deal with the early detection of child mental illness. There seems to be a general consensus among the professionals that universal screening of kids for mental health issues is a necessity, and that waiting to do it when they are in school is too late. Michelle Chase is the mother of two, one with special health needs.
We tend to act when we're in crisis, when children are entering the juvenile justice system, pretty much when it's kind of too late.
Today, mental health care experts and workers from across the state gathered to launch the third part of the massive change in laws prompted by the tragedy at Sandy Hook. The now obvious mental health instability of shooter Adam Lanza and addressing that kind of problem may be the most difficult part. Ellen Forbes is also a young mom.
The birth to three, they have that great window, because when they say your development between 1 and 3, that's your personality, that's where you learn your life view, and it's very true.
It's extremely important, because if we're able to identify the fact that when the child's exhibiting these serious behaviors, we're able to provide the services.
Another serious issue is that many insurance plans do not cover mental health treatment. So even if it's diagnosed, some families can't get the services. The governor said today that he would be willing to support more mandates on the insurance companies for this. But in the case of Adam Lanza, just a look at his mother's home tells us money was not an issue. The police report indicates she withdrew him from early treatment.
Perhaps Mrs. Lanza didn't feel properly supported in the community. Perhaps some of the terminology that was applied to her child in school or elsewhere turned her off.
And if that's the case, that needs to be addressed too. Now, these public forums will be held around the state in cooperation with Yale, sort of like focus groups from all different parts of the state, and they hope to accumulate all this information and what the experts are saying and what the families are saying and put it all together in some kind of a proposal by October of this year. Live from the Hartford newsroom, Mark Davis, News 8.